Chronic pain is a widespread health issue, affecting nearly 1 in 5 adults worldwide. It doesn't just cause discomfort, it can severely limit physical function, reduce quality of life, and even lead to psychological distress. The economic burden is staggering, with billions spent annually on healthcare costs and lost productivity. Traditional treatments like opioids and non-opioid medications often fall short due to side effects or limited effectiveness. Many patients continue to suffer despite trying various therapies. This persistent challenge has driven the search for better solutions. As we look for more precise and lasting relief, radiofrequency ablation or RFA has emerged as a promising option. But what exactly is RFA and how is it changing the landscape of pain management? Let's explore its origins and evolution. Radiofrequency ablation, or RFA, began as a neurosurgical experiment in the early 20th century. Over the decades, it evolved from a basic technique to a sophisticated, minimally invasive procedure. RFA works by delivering high-frequency electrical currents through a needle electrode, generating heat that disrupts pain signals along targeted nerves. Early systems were simple and imprecise, but technological advances have transformed RFA into a highly controlled intervention. Today, there are several RFA variants: conventional, pulsed, cooled, and bipolar, each designed for specific pain conditions. Innovations like temperature-controlled probes, advanced imaging guidance, and even robotic assistance have improved both safety and effectiveness. These developments allow clinicians to tailor treatments for conditions like spinal pain, neuropathic pain, and even cancer-related pain. As RFA technology continues to advance, it's offering hope to patients who haven't found relief with other therapies. RFA's effectiveness lies in its ability to precisely target and disrupt pain pathways at both cellular and molecular levels. When the electrode heats the nerve tissue, it causes controlled damage that blocks pain signals from reaching the brain. Different RFA techniques offer unique benefits. Conventional RFA creates focused lesions, pulsed RFA modulates pain without destroying nerves, and cooled RFA produces larger, more uniform lesions for complex cases. These approaches are used to treat conditions like sacroiliac joint dysfunction, facet syndrome, neuropathic pain, and even complex regional pain syndrome. Clinical studies show that RFA can provide significant and lasting relief, often with fewer side effects than traditional treatments. However, the choice of technique depends on the pain's origin, anatomy, and patient needs. As our understanding of pain biology grows, RFA continues to adapt, offering new hope for those living with chronic pain. Future of RFA is being shaped by rapid technological innovation. Advanced imaging such as high-resolution ultrasound and CT now guides needle placement with remarkable accuracy. Neuronavigation and robotic systems are making procedures even safer and more consistent. Researchers are exploring biomarker-guided patient selection, aiming to match the right therapy to the right patient. There's growing interest in combining RFA with regenerative treatments like platelet-rich plasma or stem cells to not only relieve pain but also promote healing. Artificial intelligence is beginning to assist with procedure planning and outcome prediction. Despite these advances, challenges remain ensuring safety, long-term effectiveness, and equitable access to RFA worldwide. Ongoing research and collaboration are essential to realize the full potential of RFA and bring its benefits to more people in need. While RFA is generally safe, it's not without risks. Complications can include bleeding, infection, nerve injury, or temporary pain flare-ups. Careful patient selection, imaging guidance, and adherence to best practices help minimize these risks. Professional societies have developed detailed guidelines to standardize RFA procedures and ensure patient safety. Ethical and legal considerations are also crucial, especially regarding informed consent and equitable access. Unfortunately, many people in low-resource settings still lack access to RFA due to cost, infrastructure, or specialist shortages. As RFA becomes more widely adopted, healthcare systems must balance innovation with affordability and fairness. The ultimate goal is to ensure that advances in pain management benefit everyone, not just a privileged few. Radiofrequency ablation stands at the cutting edge of chronic pain management. Its evolution from a simple neurosurgical tool to a sophisticated patient-centered therapy reflects decades of scientific progress. With ongoing advances in imaging, robotics, and regenerative medicine, RFA is poised to become even more precise and effective. Yet challenges remain ensuring safety, optimizing long-term outcomes, and expanding access to underserved populations. By integrating mechanistic insights, technological innovation, and patient-centered care, the next chapter of RFA promises to deliver lasting relief to those who need it most. As research and policy continue to evolve, RFA's role in pain medicine will only grow, offering hope and improved quality of life for millions worldwide.